Injectables for knee pain. Let's get into this hot topic. As a sports medicine doctor, I get many questions from my patients regarding treatments for their knee pain due to conditions like osteoarthritis and degenerative meniscal tears. I want to discuss some of these treatment options with you, their pros and cons, their different effectiveness, and discuss whether these treatment options may be right for you.
But first, the content in this video is for educational purposes only and is not to be used as medical advice. Please consult your own doctor for individualized recommendations and treatment plans. Let's get started.
Number one is a corticosteroid injection. You may have already heard of this injection as it's pretty commonly used for joint pain. Generally, it's mixed with two medications. The first medication is a numbing medication or an anesthetic, very similar to what your dentist may use to numb your gums before a dental procedure. The second medication included is the steroid or the cortisone. Generally, both of these medications are injected into the knee to provide immediate to temporary pain relief for a few weeks up to a few months. This injection is generally the first option to relieve pain and swelling in a joint. The effects generally last for a few weeks up to a few months. Pros. What are the pros of a steroid injection? Number one, pretty immediate pain relief. The numbing medication kicks in usually within minutes, and then the steroid portion kicks in within days. Number two, steroid injections are usually effective for short-term pain and inflammation relief. Generally, their effects last for days to weeks and sometimes up to a few months. Cons. What are the cons of a steroid injection? Number one, these injections can increase blood sugar levels in the setting of uncontrolled diabetes. Number two, some studies do show that steroid injections can accelerate the wear and tear or the degeneration of cartilage and other soft tissues in the joint. So it's really important to be cautious about repeated injections in the joint. Is this treatment option right for you? Consider this treatment if: number one, if you're having acute pain and swelling in the knee, steroid injections can be effective in treating this acute pain and swelling. Number two, if you have advanced or bone-on-bone arthritis. Unfortunately, many of the other injectable medications that we're going to talk about later in this video may not be as helpful in the setting of advanced arthritis. However, steroid injections may still provide some temporary relief of your pain and swelling. Number two is hyaluronic acid, aka HA. Hyaluronic acid is a natural substance found in our joints. It is a gel-like substance that can be injected into the knee to provide lubrication, more cushion, and can also decrease pain and inflammation. Depending on the formulation, it may require 1 to 5 injections over several weeks.
When looking at the research, there are mixed results regarding HA's effectiveness. Some studies showed no significant improvement in pain and function comparing patients receiving HA to patients receiving placebo and other forms of treatment. On the other hand, there are some studies that show improvement in symptoms more in the long term with HA injections. In general, the studies show that HA may be beneficial in only 30 to 40% of patients. Overall, it's important to talk to your doctor regarding whether HA may be right for you.
If you are a patient that does benefit from HA injections, the pain relief may actually be more long-term compared to a steroid injection. So in other words, it may not provide that immediate pain relief like a steroid injection, but if you do have relief, it may provide that relief for longer than a general steroid injection. Pros. What are the pros of an HA injection? Number one, HA does not tend to cause the same cartilage degeneration or wear and tear possibly seen with steroid injections. Number two, if HA is an effective treatment for you, it can provide more long-term benefit compared to a steroid injection. Cons. What are the cons of an HA injection? Number one, HA treatment may require multiple injections. Number two, there is a potential for a local reaction in the knee that may increase pain and swelling for the first few weeks after the injection. Number three, certain formulations of HA may cause a reaction if you have an allergy to egg or poultry, so your doctor may ask you about this prior to using HA for your knee pain. Is this treatment option right for you? Consider this treatment if: number one, if you are physically active. Number two, if you have mild to moderate arthritis. HA may not be as effective in advanced or bone-on-bone arthritis. Number three, if you do not have acute knee pain or swelling. As I mentioned before, HA may not be as effective in relieving pain and swelling in the short term. Those effects may happen more in the long term. So if you're looking for an HA injection to relieve pain and swelling in the immediacy, this may not be the right treatment option for you. Number four, if you are not obese. Extra weight can increase stress on the joint that unfortunately HA injections may not be able to overcome. Number three is platelet-rich plasma, aka PRP. Now this is a newer approach compared to steroid and HA. Now what is it? PRP is a treatment that involves a doctor or provider removing blood from your body, spinning it down in a machine, and then injecting the platelet-rich portion back into your body. So when the PRP is spun in the machine, it separates out the red blood cells that makes your blood red from the platelet-rich portion. That gets injected back into your knee. So what are the benefits of platelets? Platelets are small particles in your blood that help your blood to clot. They also send out signals and proteins that help promote tissue regeneration and healing. Now, while the hope is that PRP can help to regrow cartilage and heal osteoarthritis, unfortunately the studies show that PRP treatments don't actually regrow cartilage, but in fact boost your body's own natural ability to decrease inflammation and thus pain.
Unfortunately, at this time, there is limited and inconsistent high-quality evidence that shows PRP's effectiveness in decreasing knee pain and improving function in patients with osteoarthritis. Ongoing research is needed to clarify, 1, if PRP is even effective, and 2, how to best prepare the PRP to be most beneficial.
Pros. What are the pros of PRP? Number 1, many patients like the fact that it's their own body's natural substance that is minimally manipulated and injected back into their body. Number 2, so far there is no evidence that PRP causes any cartilage degeneration or wear and tear. Number 3, in the studies out there, for patients who reported that PRP was effective for them, they reported improved function, decreased pain and swelling for 6 months, sometimes up to 9 months and even longer. Cons. What are the cons of a PRP injection? Number 1, PRP may be expensive as not every insurance plan covers it. Number 2, PRP may cause a local reaction in the knee, resulting in increased pain and swelling temporarily in the first 1 to 2 weeks. Is this treatment option right for you? Consider this treatment if, number 1, you are physically active. Number 2, if you have mild to moderate arthritis. Generally, PRP is not shown to be as effective in patients with advanced or bone-on-bone arthritis. Number 3, if you do not have acute knee pain or swelling. Generally, PRP tends to improve pain more in the long term, so if you are looking for PRP to treat acute knee pain and swelling, this may not be the right treatment option for you. Number 4, if you are not obese. Extra weight increases stress on the knee that a PRP injection may not overcome. Overall, these factors are pretty similar to what was previously discussed with HA injections. The last treatment category that I want to address is stem cell therapy. Now, I get many questions from my patients regarding the availability and the effectiveness of stem cell therapy to treat their knee pain, regrow cartilage, and potentially save them from needing a future knee replacement. At this time, the Food and Drug Administration, also known as the FDA, has not approved the use of stem cells for many medical conditions, including knee arthritis. There are very few conditions in which the use of stem cells have been proven to be both safe and effective. If you have found a clinic that is offering stem cell therapy to treat your knee arthritis, please be cautious. The medical and science communities continue to closely evaluate the use of stem cells for conditions like knee arthritis, and your doctor and healthcare team will let you know if and when those treatment options become available. If you have any further questions, feel free to comment below. If you learned something, please like this video. If you want to see more content like this, feel free to subscribe to my channel. I'll see you in the next video.